It could be struggling with social anxiety, kind of dealing with just the relationship dynamics. Coming forward a bit to the 1940s, there was the refrigerator mums. So that's where the mums were actually blamed for the kids having autism, or being autistic, I should say.
Oh my goodness.
So because they didn't have the correct maternal warmth.
Welcome to podcast number 4 for the Mac and Chat podcast. This week we're talking to Catherine Aberdein about all things neurodiversity. Very, very welcome and along to our lovely, lovely podcast. Is it Catherine or Catherine?
Catherine.
Catherine. Catherine, would you like to introduce yourself?
My name is Catherine Aberdein, and I have a private practice in Aberdeen for counselling called Aberdeen Bespoke Counselling. And I'm generalist counsellor, but I do focus, and I'm quite passionate about neurodiversity.
Neurodiversity, this is one of these words that's just seemed to have popped up in the last wee while. Can you explain, tell me a wee bit more what actual neurodiversity means?
Yeah, there's a lot of different terms, and kind of getting your head around them can take a while. But so neurodiversity is essentially the diversity of different minds, so all the different types of brains that there are.
Can I just jump in there? What do you mean different type of brains? I thought we only had the one brain.
Well, going on to the next term, so neurotypical, that maybe might answer your question. So neurotypical is like individuals who are maybe kind of have a typical neurological function. So kind of like the society's norm brain, so to speak. And neurodivergent is individuals who maybe process things in a different way, and are maybe not so typical way. So maybe not the society norm brain. So neurotypical is the opposite of neurodivergent, but they all come under the neurodiversity.
So there's two types of brains, two types of processing, sorry.
Yes, yeah, kind of in that sense.
And what is the percentage on each side?
I think it's maybe about 1 in 7 are supposed to be possibly neurodivergent.
So it's quite high. It's a lot higher than probably most people would recognise it. And it's definitely something I think's been identified more in people over the last few years, where perhaps in the past it wasn't identified so easily, and even still today there's still a lot of people that go unidentified or undiagnosed, if you want.
Yeah.
But it's one of these things that you can't really. It's not like a sling or you wear a patch. It's not visible, and then people think there's nothing wrong.
Yeah, I think there's a lot of reasons that it's not been underdiagnosed, and I saw something recently which kind of explained it. It was a person, Ellie Middleton, on social media who described it quite well. It said, everyone's going, oh God, everybody's ADHD and autistic now, but it should be kind of more along the lines of, oh God, how many people have we let down up until this point?
That's good.
Which I thought was quite good, because it just has been missed. But I think there's a lot of reasons, whether it's I think social media is kind of getting people up to date a lot, and people are recognising and self-diagnosing. There's more services out there, although there's still a lot more services that should be out there. I believe the waiting lists are something between 2 and 7 years in the UK to get a diagnosis through the NHS. So
wow, that's
pretty horrific.
There's a lot of private companies that are now doing that, but they're not working in conjunction with the NHS, which is interesting. I've heard.
Some of them are, some of them aren't. So if anyone does go private, I think it costs somewhere between like £500 and £1,000. But that's just to get your diagnosis. That's not to follow through with getting your medication, getting your checkups, and going through tritation, which is just figuring out the right medication for you. But the GPs, you need to check with your GP if you are going to go private that they will accept the medication, because some of them will just say, no, you've gone private, I'm not having anything to do with it. and others, and then that means that they have to keep buying their medication for the rest of their life, private, unless they've changed their GP, obviously. But some GPs will accept it, but it's kind of seems to be a hit or a miss from what I can tell.
Mm-hmm.
Can we take a wee step back? How do you said diagnose? How can you identify? How do you recognise that your child, who you think everything's fine? What's the signs?
Well, you probably wouldn't think everything's... Well, you might think things are fine, but there would be a lot of extra struggles, I suppose. So maybe for autism, depending on the age, obviously, there's different things people struggle with. I deal more with adults than children, but obviously when the clients come to myself, they share what childhood was like and what they went through. But it could be struggling with social anxiety, kind of dealing with just the relationship dynamics between people, making friends, relationships, and quite often might struggle with organisation, burnout quite a lot. It can be quite different. ADHD, again, maybe organisation. A popular one is rejection sensitivity dysphoria. What
does that mean? You need to break things down to bite size and plain English for me.
That is a really popular one with RSD. So it's like highly sensitive, basically. It's quite often a good way of describing it is like if you imagine slapping someone's back as a joke with, just saying, oh, that was really funny, they'll be like, wouldn't bat an eyelid. Mm-hmm. But if you imagine you had sunburn and then I slapped your back, that would probably really hurt. So it's to other people, it's what's perceived as, a lot more, harder to take. So they're a lot more sensitive to either perceived rejection or actual rejection. So that's a huge one, a huge symptom for ADHD.
I want to know a wee bit more about you and what was your path?
I think it kind of found me rather than I found it, because I always wanted to, maybe have a specialism in counselling, but I wasn't quite sure which direction. And then I suppose a couple of autistic clients came along to me, and I realised that I worked quite well with them and was quite passionate about working with them. And then I just kind of did everything I could to make sure I was doing right by them by doing courses, reading up on a lot of things. I've done a few different courses. Recently I did a 6-week ADHD course with Dr. Alex Connor, which was a brilliant course, and I'm in the middle of a 6-month.
So the courses, what did that involve?
Well, the ADHD one was really good because it was about 200 people, and mainly ADHD, like general public, but also some of the health professionals. So it was kind of a mixture. So it was kind of going along, finding out about ADHD, how to cope, and I suppose just feel less alone, I think, was the biggest thing in it. Everyone was resonating, a question was asked, and, what's the hardest thing with your ADHD? And it just, RSD just came up, the rejection sensitivity dysphoria just kept coming up.
Is that a common factor throughout?
Yeah, absolutely. From that course, I got the idea that it was, but weirdly, it's not on the diagnosis criteria for ADHD. It's one of the most popular symptoms that people have, but it's not in the official criteria for it.
So it sounds like, that what they're still trying to do is still trying to figure out all the different aspects of ADHD and neurodivergence, and the medical profession, if you like, and the diagnostics are still quite far behind in it all, which is probably half the battle that we've got at the moment, in helping people who have been diagnosed or suspect that they may be on that scale.
Yeah, absolutely. There's definitely a lot of work to improve on that.
And the NHS is quite far behind.
I was actually listening to, I think it was either LBC or Radio Scotland, about this with kids, and how there's different levels with kids, 1 to 10 or 1 to 100, and it all depends where you are, and that's how much help you're going to get.
Okay.
Is this correct?
Well, as I say, I don't deal with the kids side of things, but I mean, I know there's obviously a spectrum.
Yes.
So depending maybe where they are on the spectrum, I have heard that unless you're at probably the higher end of the spectrum, you might not get the support, and the kids might not get the support that they need because they're not high enough up, and there's only a certain amount of support there.
Well, look at me. I look at sometimes. You touched on a few things there, like being a loner, growing up yourself. If we've touched on some of these things here, what's my next steps? If I'm sitting going, well, that sounds a wee bit like me, and that might answer a few questions in my life, not me personally, but if you're sitting there, well, I am sensitive, I don't cope well in society, I am a loner, I don't make friends easy. What's my next steps?
I think first step is depending on where you're at. You know, if you're thinking, you know, maybe you might be autistic or ADHD, then and you would like a diagnosis, then that would obviously be to kind of have a chat with your GP first, and kind of head down the diagnosis route. Or maybe having the diagnosis is not necessarily your main goal. Maybe it is just finding support for these things that you struggle with, whether it's social anxiety or organisation or anything along those lines. You could maybe go to a counsellor and, you know, find coping mechanisms and absolutely talk through, you know, what you resonate with. You know, coming to counselling, we don't diagnose. However, whether a client has a official diagnosis or not, we just work with what the client feels. We don't need that bit of paper. You know, I'll be guided by my client. You know, nobody knows your client better than they do. So if they resonate with these things, then, you know, we work with that. So it can be just about, you know, coping mechanisms and helping them with whatever they struggle with.
Also, sometimes I've noticed in my counselling room that clients are coming in and they're expressing all these issues or these feelings, and they're not aware of what that is. And as much as I'm not going to be able to diagnose them, I can actually, you know, say to them, perhaps this is something you maybe want to think about or consider. Because it often clients who come in with anxiety, ironically, was the one that I noticed the most, was clients with anxiety were coming in saying, I'm anxious, but actually it didn't feel like that to me. It felt like it was something greater than that. Not that anxiety is minimising anxiety, but once we actually started working together and spending time together, we discovered that there was probably more going on there than they realised at first. And then if subsequently received diagnosis, and it's almost like the penny drops and they've got this diagnosis, and it's like, so that's what's wrong. That's why I feel the way I feel. Answer
a lot of questions throughout their childhood and their lives.
Yeah, and explains a lot of the way that they behave and how they operate. And I think for that it's so powerful because it changes everything in so many ways. It just gives it's as if somebody's just opened the curtains and they can see clearly now about what's going on in them, and you end up working with them in a much more differently than when you would have if they were just coming in with anxiety, if you like.
Yeah, and I think that's something you have to be very careful with as a counsellor, you know, in getting to that point, you know, make sure you've got the relationship with them before you kind of tackle that.
Definitely,
you know, are you aware of neurodiversity, you know, and kind of finding out if they know anything about it. And then if they do, then, you know, you can obviously kind of head down that route. But yeah, it can be very helpful for you to kind of say, you know, I wonder if you resonate with any of this. And yeah, it starts a whole different journey for them and figuring it out.
It would be a shock. It could actually go one or two ways. It could become very defensive. Yes, I mean, that could possibly... not me, I've never...
Yeah, which is why Catherine's saying until you've got a very well-established therapeutic relationship, and as a counsellor you have an understanding of it as well.
When to drop it and when to...
You know, we don't want anybody just going in there and say, I think that might be that, when, you know, as Catherine says, we're not qualified to diagnose. However, in our experience of working with clients who have, we were probably able to spot it maybe better than some others.
We've talked about this before, about the peeling of the onion once these layers come back.
That's right. Yeah,
I remember these things she tells me.
You've been listening. But you know, an interesting story. My husband, who I've been with for a long time, I recognised that he had a lot of traits of someone with ADHD. And we were driving home from being away somewhere, and I said to him, would you ever think that you might have ADHD? And he says, what do you mean? So we started talking about it, and then I did a test with him, and actually he came back with a high percentage that he had. And for him, it was been life-changing, because he suddenly goes, oh, that makes a lot of sense to me now. And, you know, but I was with him for years and years and years before I suggested this to him. So it is something that you have to approach very sensitively to somebody, and be fully aware that you might, you know, you could upset someone by having that conversation.
Yeah. Yeah, and I think that's where, you know, possibly the judgments and the stigma can come into play, and depending on, you know, what their opinion of neurodiversity is, then that can affect how that whole conversation goes.
I like that. Depending on someone's opinion.
Yes, I picked up on that there.
It's so true. There is so much. Do you think there's stigma attached to it?
Absolutely, yeah. I think that's like a huge part of it. It was really interesting on the, especially with the autism course that I did recently. They went into a lot of the history behind what got us to where we are now with autism. And it went back to even, you know, back in 1911 or something. So it was actually autism was considered as schizophrenia.
Oh, wow.
So right back then, and then, you know, coming forward a bit to the 1940s, there was the refrigerator mums. I don't know if you've heard that term.
No.
The what?
Refrigerator mums. So that's where the mums were actually blamed for the kids having autism, or being autistic, I should say.
Oh, my goodness.
So because they didn't have the correct maternal warmth and empathy. So they were actually, so can you imagine being a mum of an autistic child, and society blaming you for your child being autistic. And then, you know, as it went forward, there was lots of pretty horrific stories, you know, that they shared for, you know, autism coming back even to the, you know, present day. But there was, you know, I think in the 1980s, there was a lady called Lorna Wing who was actually quite good. She kind of, I think, was well respected in the autism community, and she, you know, created the spectrum, I think, and recognised just how much autistic people there were out there. But even in the 2000s, I think they shared a story of a guy called Tony Atwood, I think, who's a bit controversial in the autistic world, who's an expert, or I should say expert in inverted commas, in the autistic world. And he had a theory, the Cassandra theory, which said that all autistic males were abusive in relationships. And that's like a huge judgment.
That's horrific.
How can, I can't get my head around somebody can label every male like that.
Yeah, and that's an autistic expert, but he also missed his son's diagnosis of being autistic. So you can.
It seems like it's very unregulated, and
yep, there's a lot of
everybody's opinion seems to be
misinformation.
If I'm telling you it's blue and telling you it's blue, and it's actually green, but you're believing it's blue.
Yeah, and that's the problem that a lot of people have.
That's actually sorry, Rose. That's actually, I'm absolutely shocked here that this is getting out here and nobody's challenging them and saying, well, no.
Mm-hmm. Yeah. Mm-hmm. And even like, I think the autistic charities that were first created, I think a lot of them were created not by autistic people. So even if you recognise the jigsaw puzzle is quite often used for the autistics, and they don't like it. The autistic people don't like the jigsaw puzzle because it kind of insinuates that there's something missing, or there's needing fixed.
Yep.
So, you know, that's some of the charities, you know, logo.
We can go back and look at charities and what they were called years ago, and they're not very politically correct. Not very politically correct. They're not correct now.
No, my friend's son's autistic, and she said something to him once that really stuck with me. She says, his world's absolutely great. It's the rest of the world that needs to change. And I thought that was so powerful, because it's true. You know, we have to be a world where we accept everyone and anyone for whoever they are, and not try and want to change them or label them. And in actual fact, I find labelling something that I strongly oppose, labelling people. My thinking is your brain works differently to my brain, and that's all it is.
But Rose, my brain works differently from your brain.
And I don't label you. I don't label you
all
the time.
All brain.
But
all our brains work differently.
But do you know what I mean by that?
Yes, I do.
This labelling, I know it helps people, but sometimes it can be a complete disadvantage for someone, isn't it?
I think it's a very individual thing. I think, as you say, some people do not like labels and, just don't want anything to do with them, and others like it. It makes sense. It could be that the diagnosis.
You're seeing a lot of people just now in social media striving and looking for that label. I'm not saying it's quite worrying, but that's what they put out there first. Hi, my name is Anaya.
But sometimes instead of people trying to it's to feel part of a tribe, isn't it? If you've got someone who you can connect to, who's maybe got the same story as you're relating to them, and equally another time it's just to maybe gather something, likes or.
Yeah, be part of a community. I think.
Yeah.
Probably one or two of the biggest messages I got from the recent training course was just how important it was to find your tribe, which is it's probably a counselling term. It's just find your people, find your friends.
It's a word that's coming up more and more and more, because we were talking about one of the previous podcasts we did about the word tribe, and it was a football thing.
Okay.
But then it switched within the same podcast from being a football thing to a club music thing, where in that tribe, and we're all full of tribes. We're a village full of tribes, and that is true. It's about fitting in and finding people
the one that works for you.
Yeah, and feeling less alone.
And sometimes the tribes, as like the Olympic symbol, you can be a part of 3 or 4 tribes.
Yeah, that's true.
Yeah, and I think what you mentioned before is not necessarily about us, necessarily changing or trying to. It's not about just trying to help the, autistic or ADHD person. It's, society needs to change as well. That was a huge thing. It's the environment,
Exactly.
If you, take a child, for example, in school environment, who might struggle with sensory issues, then, the school bell ringing and kids' noise and different lights and smells, that could just be horrific. And they could then have a meltdown in their class. But if you are able to adapt that environment, even give them, a chance to say, okay, I need to, have a timeout or change the environment to them, then there isn't an issue. So quite a lot of the time it is the environment that we need to look at in society.
I know some, like supermarkets, for instance, have been very good, where they've started to make times for people to go shopping when it's less overwhelming for them, and set a better environment for them. So, we can do it. It's not that we can't do it. It's just maybe more a question of why are we not doing it more quickly.
Yeah. There's still a lot that needs to change, and obviously there's a lot of advocates out there who are working on that, but it's a slow process.
Would you see yourself as an advocate?
I think I'm heading in that direction. I'd like to think I am, but obviously I can't speak on behalf of that community. But I've learnt a lot, and I'm happy to share what I've learnt. I suppose.
Yeah, I would say so.
Yeah.
There's just going back through my memory banks here. I watched a brilliant documentary on the radio presenter Ken Bruce and his son. He's non-verbal, but it's absolutely fantastic because he had he's an artist and he does this and does that, and I think people are too much saying no instead of pushing their talents.
Yeah. Just because they're not able to communicate doesn't mean to say that
you can communicate by other ways, Roz.
Exactly. Exactly.
Music as well. A lot of people can communicate by music.
Yeah, I saw someone who's non-verbal but can sing. Can sing all the songs that put in the radio, but actually can't have a conversation with it. So the brain is actively working in different ways, just not what we would normally expect. And I use the word normal in inverted commas there.
Yeah, and even in some of the autistic people who are non-verbal can speak in certain settings but can't speak in others. So they might speak absolutely fine at home, but then when they go into class or go to something else, they don't say a single word, or vice versa even as well. So it can be different settings as well.
I'm going to take you back. Things trigger me. It's just, there's something that's come into my head. I need to share this wee story with you. We set up a community radio station in Barrhead possibly 10, 12 years ago. And it was for the youth and the community. And it was based at Barrhead High School Janitor's House. And we had a girl who came in who was on the spectrum. She was brilliant, fantastic, outgoing. And she spoke with a North American accent. We engaged with her. We showed her how to use. We babysat her. And then we gave her own radio show. And she's coming on leaps and bounds and leaps and bounds. It was like watching this seed grow. And it really was. It really was watching this seed grow. And from going for somebody who was walking about like this to shoulders back, head out.
Flourishing.
Yes, totally flourishing.
You probably provided the right environment.
We monitored. We were. But it wasn't intentional. We just treated everybody the same, like we talked about. We treated everybody the same. We didn't care. We just wanted to turn people to radio to get them out there and get their voices heard. So we're driving. We always monitored our shows. At first, we were sitting in the corner, telling her to do this, and helping her with buttons, like we did with anybody. So we let her on, and we're listening to the radio show one night, and I'll never forget it. I'm driving. I've just had a cheeky phone call, and I was like, stopped the car, pulled over. To the gentleman that said to me, "Why are you speaking with an American accent?" Well, I'm telling you, I'm not from America. I'm from the Bower Walls in Barrhead. I'm like, car crash time. And I was waiting for the breakdown. And I've been told by Paul and Raymond, if you don't like it, you can turn to Clyde 1. And I was like, go girl. It was a proud father moment. I was like, we've taken this person and given them the confidence, but also given them the freedom.
Exactly.
Which
and a voice.
And a voice. And I was like, absolute fantastic. So I went back to the shows. He's like, how did the show go? Oh, it's just the one complaint today. And what did you tell them to do? I was good. I never told them to get deep. I just told them to tune to Clyde 1. If they don't like me, I was like that. Go girl. Brilliant.
That's amazing.
Yeah.
And it's just something that triggered me because
that's a great story.
And I wasn't picking it up. It was just giving kids
the right environment.
Yep.
Yeah.
The
Teaching
freedom.
them properly.
No judgment.
No judgment.
Yeah.
No judgment.
Yeah. And I think, confidence is a huge thing, whether it's, autistic ADHD or anything, confidence is something probably you end up working on with a client because of society, growing up, whether they've been bullied in school or, made to feel an outsider or just judged or whatever it might be, there's normally, some trauma there. And, building their confidence up again is such an important thing as well. So
you're primarily adults you're dealing with.
Yeah.
Why have they not been diagnosed before?
Oh, I think there's a lot of reasons there. There's definitely more services out there now, but there's still a lot, as we were saying, still a lot to be worked on. More of the kids are getting the diagnosis now, but when the kids are going and being diagnosed, the parents are then realising, because it's highly genetic as well, the parents are realising, oh, I've got those symptoms, so I'm like that. So a lot of the parents are kind of self-diagnosing themselves when the kids are going through it.
I didn't know that.
Did you not?
No.
Yeah. The genetic side? Okay, yeah, it's highly genetic, yeah. So there's that. And I think, partly all the stigmatism as well. So a lot of people are maybe not going. I know clients who've come in and they've thought something was maybe up or someone's maybe mentioned to them, have you thought about maybe getting a diagnosis? But the parents who are from that generation, from all the stigma, from the history, which we've just mentioned, think, oh, there's nothing wrong with you. You don't have that. That's not,
You're just the same as me.
View it as a very negative thing.
I was like that when I was young.
There's nothing wrong with you. Well, there isn't anything wrong with you.
No, there isn't. There isn't. But that's the parents' view. So they don't follow it up, or they might not do it because of the stigma, because of the judgment. So there's maybe a lot of people not going because of that.
I also think, have you seen the questionnaire that someone has to complete to be even seen by the NHS? So you'll be referred to the neurodiverse, I don't know what they're called actually, what the unit's called in the NHS, but then they're sent this like
massive forms.
Form to fill out, which in itself is overwhelming for someone who is.
Well, it's ironic because the thing that autistic and ADHDers find really hard is form filling. So they're given loads of that to do.
Yeah, and then they have to give it to their parents.
Yeah,
to do
they get a 360
well.
of friends and family, and
if you've got a parent who's on spectrum as well, that's a big issue for them to sometimes even recall what was going on in childhood. So
yeah,
I mean, it just seems an archaic way of diagnosing someone.
Yeah, and then I think it's quite often in the counselling room, I'm helping them recover from the diagnosis process because it's so traumatic. Yeah. Because even if you think of the ADHD one, for example, the DSM-5, which is the Diagnostic
Statistics Manual.
Thank you. Of mental health.
Yeah.
We are really getting complicated here, aren't we?
That's just the diagnosis, the list of symptoms. So it's, the ADHD, for example, it says deficit disorder, abnormal, inflexible.
Very negative words, aren't they?
Yeah. Hugely. And in order to get your diagnosis, you essentially need to admit that you are deficient in A, B, C, D, E, F, and G. And then after that, you will get your diagnosis.
So it's a self-diagnosis then, the first?
Well, I mean, you're filling out these forms which are answering that you're deficit in all these areas. And so you
think of the trauma that creates in someone who's having to, go through that. And
you're talking about filling these forms and I'm getting traumatized.
Yeah.
So once you've gone through that,
but do you not
easy.
Do you not think sometimes these filling in forms, it's just I'll try to put people off?
Well, I had a client who filled out her form and came back and they said, we don't think that you are. And I said to her, why don't you bring your form in to the counselling room and we'll have a look at it together? And it was really interesting how she had interpreted the question versus how I would have interpreted the question. And that just actually going through it with her and talking about each question individually allowed her to actually put in different answers. And those different answers then got her through to being assessed. Yeah. Because the form itself was confusing for her, it overwhelmed her. Yeah. And so taking our counselling session for us just to go through each question and help her understand what they were looking for, what they're actually asking, helped her get there. But there's so many people who don't have support, and thankfully she was, brave enough to bring it in and go through it with me and we went through it together. But I was shocked, I was thinking I would find this difficult to complete. Yeah. So having somebody to help you do it was really helpful as well. So I think, if somebody is struggling with that, finding someone to support you in completing the assessment questionnaire would be really powerful for someone. Yeah,
I think having support throughout the whole process, really,
absolutely.
Whether it's personal, friend, family, partner, or professional, having a counsellor support you through that diagnosis is incredibly important. And even, the questions, as you say, like, an autistic person thinks differently, So, do you experience anxiety, for example? They'd be thinking, well, when? What time of day is it? Where am I? Like, who am I with at the time?
Yeah, and
that's just one question, and they're like, I can't answer that,
That's exactly it.
They, think through everything. They, they think past each question, and it can be incredibly hard.
As well, I'm going to say yes or no, they'll be like, I need the specifics.
Yeah.
What time of day? What am I wearing?
Exactly.
Where am I? Who am I with?
And that's why when you're doing something like
what's the weather like outside?
It can't be done on a piece of paper. It has to be a kind of face-to-face assessment as far as I'm concerned. But you can't get that until you filled out the piece of paper, which for me just doesn't logically make sense in terms of the diagnosis process.
Yeah, there definitely needs to be a change in that as well.
Yeah, unfortunately I don't know how far away we are with that given.
Yeah, and I think it would be asking, the people who fill out those forms, how you would do the diagnosis, what would make it easier, what would make it less traumatic. It would be asking them.
Surely that's an obvious.
You think?
You'd think, wouldn't you?
Yeah.
What do you feel is the most important thing for people to know, either about themselves or understanding themselves when they're diagnosed with this?
I think, well, we touched on a little bit, I think the tribe, I think finding your tribe, because feeling alone in the diagnosis is quite a huge thing, you know. And quite often, so many of my clients say the word isolated or felt weird, felt like an outsider, you know. So actually kind of reminding them that they're not alone in this, you know, there are other people who are going through this, who have been through this. I'm not saying it's the same experience, but, you know, feeling part of something or just knowing that other people have been through something you've been through can kind of be of some comfort. So I think, feeling less alone, finding your tribe, understanding it. You know, some people don't know necessarily what it is. They haven't done the research. You know, they've maybe gone through the diagnosis process, but actually haven't read up on it and learnt about it and understood it. And so knowing, you know, knowledge is power, I suppose. Understanding yourself and then knowing what supports you can have in place. So whether it's online coaching or counselling or asking what you need in your workplace or asking what you know, having the support at uni. So I think just kind of initially it's about, you know, understanding it, I think is a huge thing.
Yeah, so the education part of that is the most powerful part of that.
Yeah.
And then from there on in looking at what other support is out there.
Yeah.
And what
accepting.
What about if you're with someone who has been diagnosed, what would you say would be the best way for you to support them?
Well, I would be asking them that question because I suppose they can come to counselling and it might not actually be anything to do with their, you know, being neurodivergent. So I'd be asking, you know, what's their main struggles? What do they want coping mechanisms for? And, you know, what's brought them to counselling? So I would kind of find out that first, and then they would kind of share what their day-to-day biggest struggles are. And then we would, you know, work on whatever that might be and finding the relevant coping mechanism.
What is the most common struggles you're finding?
Well, with neurodivergent, there's a high percentage that have other coexisting conditions. So they've got a higher chance of having depression, higher chance of having anxiety. So depression, anxiety are big ones. Social anxiety is a big one. Whether they've brought it or not, I always try and work on self-care and self-compassion because that's a huge one. You know, learning how to look after yourself, care for yourself and be kind to yourself. Yeah. That's always a huge thing. I mean, with any client, it's a popular one that we end up working with, isn't it?
It's the most important one for me is being compassionate with yourself and looking after yourself. Yeah. And I also think, you know, when someone's coming in and they're presenting with depression and anxiety alongside the neurodivergence.
Just stole my thunder there, Roz.
It might be that, you know, they don't know how to do all these things that we're saying about, you know, you said, well, ask the person what they need to help, but they might not actually know themselves what will help. And I guess that's the benefit of going for support, like with a professional, like a counsellor or a coach. Yeah. They can give you that path, they can give you that direction rather than trying to figure it out on your own. And also in a family situation, helping the family as well, because sometimes the family don't know how to necessarily support the person either.
Yeah. Navigate the relationships around them can be quite a tough one as well. But yeah, it's you know, if they say, well, I struggle with organising myself, you know, I'm always late or, you know, whatever, then you know that it's kind of working in organisation, you know, or if they're like, I can't get out to social events, I find it really hard, then, you know, it's working on social anxiety. So, you know, they just need to know what their struggles are really, and then we can kind of point them in the right direction and help them in the right way.
And do you find that they're open to doing that? Do you find when you're working with your clients that they're open to making these changes, or they struggle to make these changes?
I think it's like any client, you know, it's whether you're open to the process, you know, and if you're willing to kind of put in the work and do the work in between the sessions, and you're there with a goal, and yeah, absolutely, you know, they're great. They'll work on whatever they need to and come back and share their progress. But then there's ones that are kind of not 1 foot in, 1 foot out. They're not quite ready to make the changes, in which case it can be quite challenging.
What kind of, we always reframe back this in different aspects, what kind of work would you ask them to go away and do on themselves?
Oh, it could be lots of things. Depends what you're working on. So I suppose social anxiety is a popular one. So it could be kind of literally having baby steps to working towards being able to go out. I mean, it could be just even, you know, going out to the shops first, you know, not just going out and buying something, coming back home, not even going to a big event.
Getting out the front door.
Yeah. So, yeah, it could literally be going out the front door and walking around the block and going back in again, you know. So it's breaking down whatever goal they have, breaking it down into baby steps and hoping that they can come away and try that baby step and feel good about making it, rather than giving them a massive goal and coming back and saying, I didn't manage it.
So would you sit and give out 2 or 3 goals, or just do one goal at a time, and that leads to
I think
the next goal?
Again, it very much depends. Some of them, you know, want goals and they're like, right, what am I doing this week? What am I working on? You know, and others are, you know, it's just giving them one at a time, because you know they're going to get overwhelmed, or, you know, if you give them 3 goals, they will be overwhelmed. So it's just basically on a client basis.
Your expertise kicks in and says, I know how the extent of this person, I know what this person's capable of, and how far I can, not say push them, but help them.
I think that there's a tool that we can use in counselling called the fear ladder. Which I think is a really helpful way for somebody to think about it. So all you're doing is taking the first step. So the ultimate goal might be to go into a bar or something and have a drink with friends. But in order to get to that, we have to take the first step. And so the first step would be that. And so you take them through that, rather than going, right, you're going straight to the bar and doing that.
So the first step would go post a letter.
Yeah. So that could be a first step. And that's a good kind of picture for a client as well, that they've got there's a bunch of steps to go before they actually need to be, and you only take the next step when you're ready. You know, it's not something,
and they pick the steps as well.
They pick the steps, exactly,
What do you mean by pick the steps?
So instead of me going, right, here's your 10 steps, I'll say, right, we want to get there in step 10, but what's your first step? What do you think your next step will be? You know, so it's just like any change in life, you know, you need to get on board with that change. So if it comes from them, they're more likely to be motivated.
Because ultimately what we're doing is we want to empower clients. Yeah. So we want them to be empowered to do it for themselves, rather than, I did it because Catherine told me.
Ross told me I must do this because Ross told me. I must do this because I want to do it.
Exactly. That's exactly.
I want to get there.
Yeah. And quite often part of the ADHD is the pathological demand avoidance, which is just, if you get told to do something, then it's straight away, no, I'm not going to do it. You just automatically, they're like, tell me to do something and I'm definitely not going to do it. So making sure it comes from them as well is hugely important, especially ADHD side of things.
It's a lot to take in.
Well, I think it's a very, very big subject, and you know, we're only scraping the tip of the iceberg with some of it today. But I think it's really important for people to be aware of and understand that you're not alone in this, and there are people out there who can support you and help you and find ways to give you a better life if you're struggling with your life. There's also a huge amount of people who have been diagnosed and are living their best life, and they're celebrating who they are, and you know, so again, it's not always and I'm going to use a problem. Sometimes it can be, you know, an absolute benefit to have a brain that thinks the way it does, and the things that you can create and do for yourself. So let's also acknowledge that as well.
Celebrate them,
because I think you know, it's very easy. what does ADHD stand for again?
Attention Deficit Hyperactivity Disorder.
So that word disorder.
Yeah,
is the
deficit
bit,
disorder.
I mean,
that's a double negative.
Yeah, they don't like that name either.
Why would you, and I think, it's ridiculous that we're using language in this day and age like that.
Yeah.
In my opinion, and it is my opinion only, but I do think it's really part of the problem, that we're, as you say, we're not speaking to the people who's most affected by it. It's somebody somewhere's making this decision and calling it these names. And
yeah, there is a whole positive side to it, as you say, and I think with probably both autistic and ADHD, they can be quite passionate. They sometimes have an interest that they're very passionate about, and I think if they can find their interest and relate that to a career, then they're laughing. They're hugely successful.
I'm not laughing at you. I'm just you must be reading my mind here, because I'm going through my memory bank here about what we're talking about. There's been great child artists. I remember seeing one who was a pencil artist, and he could look at something and take a picture in his mind and draw it to scale and exactly the way it was. And he was on the spectrum. And there's been great child chess players and child musicians as well.
Yeah, that's
Beethoven and Picasso, I'm sure, are amongst those.
Because these people, unlike me, can focus on one thing. And sometimes I can't focus on one thing. As Roz knows, sometimes I'm all over the place.
Yeah.
So this is an advantage that they've got, and it's not a disadvantage, as we're, like you say, society is that no, it's this. So you're right in what you say, Roz.
I want to celebrate these people.
Yeah. And I think an ADHD person, I think I read something, it was like, in order to put in the same effort as somebody else, for example, school and exams, they have to put in about 500% effort compared to 100%.
Wow.
In order to get the same results as a neurotypical. So, they can be incredibly hard workers and determined, and, there's a whole list of things that they're very good at.
Do your clients ever go back to their parents and, I hate to say this word, analyse them?
Yeah, quite often have the conversation, because they're maybe describing their relationship with mum or dad, and say, well, dad doesn't do, maybe emotions, and or mum never kind of can speak openly about how they feel, or whatever it might be, and if I know that they've got their diagnosis, then I say, do you think mum or dad could be autistic or ADHD? And then you see the penny drop, and they're like, oh yeah, I think dad's autistic. Yeah, mum might be ADHD actually, so they can quite often maybe figure it out before the parents have realised.
And that'll be helpful for them as well. And if understanding your parents is, we need that for all our clients.
Yeah,
it's like you said there. If you're in a situation within a counselling room, and we've talked about this, you've never had a mother's love, or your dad's never told you he's loved you, which we do to our kids, and you're suffering because of that, and you've identified, you might just go, oh, the minute the penny's just dropped here, I'm not the problem.
Yeah, exactly.
Well, Rose will tell you I am the problem.
No, you're not. You're most definitely not. But yeah, I think that's so important, if they have, because for me, whenever I talk with a client about their parents, I always say, it's to help us understand our parents, not to say anything negative or bad about our parents, it's to help us understand our parents, and how by understanding our parents and their behaviour helps us understand ourselves.
Yeah.
And so if you've got a client who then suddenly has the connection to that's why they do what they do, that makes sense. And as you say, it's not me. It's what's happened to them, or what they're experiencing.
Yeah, and have more understanding for one another as well, once you know that. And I think I maybe said this to you before, but I always use the toolbox analogy. So, all of our parents got given a toolbox from their parents, and sometimes there's a tool missing. And that just toolbox gets handed down the generations. And it's not until someone maybe comes to counselling and I say, well, actually, it sounds like that tool was missing from your parents, because I always sense, that they're like, oh, don't judge my mum and dad, but as you say, we're not there to judge. We're just there to figure out, things and help them understand their parents, help them understand themselves. And so once you know that tool's missing, that's when counselling can come into.
And the counselling can put the tool back in the box to be passed down again.
Toolbox.
Yeah, refill it. Mm-hmm. We had this before about filling boxes and water overflowing, haven't we, Ros?
The bathtub
analogy, Yes, I remember these things. I think taught me well.
One of the biggest things that I've found as a counsellor is about helping people to understand themselves, helps them to understand others. Mm-hmm. So when we're doing that, when we're understanding ourselves, and the kind of fallout from that is that we then help us understand other people. Mm-hmm. And if we can be compassionate with ourselves, then we're likely to be compassionate with other people as well. Yeah. And then we're breaking cycles of generational stuff as well with that. So, counselling is so powerful. Any form of self-reflection and self-understanding is so powerful because of the implications it has to not only yourself but to everybody else as well, hence I'm a big advocate for counselling, Catherine.
Yeah.
And you?
I have as well, yeah.
Wise have got jobs doing it. That's another story. Do you think that once people have been diagnosed, it makes their life, their 9-to-5 job or their family life or their life with their colleagues a lot better?
I think it can. And again, like everything, it's environment, like at work, you can then say, I've just had this diagnosis, I maybe need quiet time, or I can't work in an open plan office, or, I can't sit near the kitchen because of the, overwhelming smells, or, whatever it is, you can ask for what you need. And the same at uni, a lot of students, it can make their lives much easier. They can be given a buddy, people can check their work, they get given free access to mental health apps. So, knowing what you can, having that diagnosis can open doors. But like everything in life, you might be judged. That depends what your manager is like at work. Are they open to giving you that help? What's their knowledge of neurodiversity?
There's also the flip side of that, where you have a client who doesn't want to accept their diagnosis. They don't want to be seen to be different.
How do you handle that, Ros?
Well, it's very difficult because, again, it's what the client wants, and if they find it that they don't want to accept that that's how they are, they want to be normal, and especially I think for young people as well, who spend so much of their time looking at peer approval and wanting their peers to approve them, for them to say, oh, actually, I've got this ADHD or autistic diagnosis, and therefore I'm not like you, and then that suddenly isolates them again. Mm. So I don't want them to know that about me, so I'm going to try my best to fit in, and nobody will guess that. And I've experienced that.
Surely by doing that, that's you're hiding something. That's going to double done. That's going to be double effect on them.
Well, sometimes they work really, really hard to disguise that that's what's going on with them, and try everything they can, despite what it's doing to them, the pain that it might be causing them internally or emotionally. They're going to avoid that.
I think it's trying to maybe take it from an angle of knowledge again, so they're probably coming from a place of, either judgment or stigma from themselves or those around them, or they don't know enough about it, because, you aren't weird, you aren't, whatever, other negative connotations. It's your brain works and processes things in a different way, and that's not necessarily a bad thing.
And when I was born in 1970, don't laugh. And when you look back at your childhood and you look back at the kids you went to school with, the one of the better words, the loners or the weirdos, you can now identify that we never had this back then. We didn't identify with these people back then. We didn't know that. But right now in schools, I think there's a lot more identification where teachers are saying, well, have you looked at this? Teachers are now getting trained within can you see these?
Yeah. And interestingly, you say that because it reminded me of a conversation I had recently, and it was I think I can't remember who it was with, but anyway, speaking about even back in childhood, if you think the kids who were getting bullied were highly likely to be the autistic person, so the kids could figure it out, but not the adults.
But sometimes
so you think they can spot it a mile off, but the adults' teachers didn't.
But sometimes it was the bully.
Well, the bully spotted it.
But sometimes it was the bully who was on the spectrum as well.
Yeah, it could be that way around.
Because they switched it to make themselves, how do I put this in words? Try and fit in. To be the number one, because they felt
to not show that they're strong or they're able might well be in the way of how they managed what they were feeling. Yeah, or maybe that's what they experienced in the house as well. Bullying starts from somewhere, doesn't it?
Yes.
So that sometimes can be the case as well, and that's probably another conversation at some point in the history of bullying and where it originates from.
You think it's a norm? Same as everything, it passed down from your parents or your grandparents. You think it's a norm. It's about breaking the cycle.
Yeah, and it's not showing weakness. And I think that going back to that point I made about not accepting that you've got a neurodivergent diagnosis, is some people think that that's a weakness.
Yeah,
and if they've been brought up to,
they're often adverse to it.
They've been brought up to believe you need to be strong and not show any weakness. That's going to be anti what their core belief system
trying to hide it.
Yeah, so it's not as straightforward as, here's your diagnosis, off you go. It's actually, I don't want to be like that. I want to just be like everybody else, and that can be real challenging for someone.
You mentioned a word, that the apps. What apps are available?
Oh, there's lots of apps.
I
suppose it depends what you're looking for. So, I mean, for the uni, I think they provide free access to like Headspace, which is a popular kind of mindfulness app. So, just listening to could be various like just relaxing music, or it could be a voice just kind of talking you in a calm manner, de-stressing you, or it could be breathing exercises or a body scan talking you through relaxing each part of your body. So it's kind of looking after yourself and relaxation type apps, or even, I know that's the ones that the uni some of the unis offer, but again, there's probably a whole different ones, organisation apps as well, that can be a struggle. So apps that just organise your diary, prioritise things for you. There's a great one I heard of recently I think it was called Goblin or something. Have you heard of it? No. For ADHDers, so with the RSD, they think or perceive the rejection. So you can actually go online and type in, my friend said this to me, and, found it really upsetting. And the website will tell them whether they need to be offended or not, because they overanalyze everything. And it's such a common thing. So you can actually go on and check.
So that can help with that overthinking. Yeah. That's a really good idea, actually.
There's kind of, as always, there's an app for everything.
And Google will take you wherever. Yeah.
He's brilliant though, isn't it?
Yeah. Catherine, it's been really, really interesting. I feel like we could have probably talked about this a lot longer, and we really have only scratched the top of the tip of the iceberg on all of this. So thank you so much for your insights.
Before you go, what advice would you give to somebody? That's a question I always ask, my last questions.
Okay.
What advice, if you identify of what we are talking about today, or your child, or one of your colleagues, we're all saying look out for each other. Mm-hmm. If you have identified, you're talking about Joe Blogs next door, or Joe Blogs I work with, or Jen Blogs, what advice would you give to that person?
Do you mean like someone who's just figuring out that they...
No, I'm not identifying, but I know somebody who has not been diagnosed. Mm-hmm. Sorry, not. And I've spotted this in this person, because we always say about looking out for each other. Mm-hmm. So you've got this person a friend of yours who has hit everything we've talked about in the last wee while. What advice would you give to this person not to approach them, but what advice would you give to them?
I think similar to us working with clients, I think tread very carefully, make sure the relationship's there, and then maybe just approach the subject of neurodiversity, see how they respond. You know, their response to that topic will tell you straight away whether they're open to it or not. And then if it sounds like they are, you could ask, you know, have you ever resonated with any of the, you know, symptoms of, you know, ADHD or autism or whatever they might you're thinking of, and see how you go from there. But again, it's treading very carefully on how you go there.
One of my roles within London SGB is a mental health first aider, and we like to look out for people, and if we identify things and if we see things, it's good to know that how do we approach that. That's great help. Thank you.
Yeah.
So Rose was saying,
I was going to say, we always ask our guests at the end, what's the best advice that you've ever been given?
I think probably something quite simple, which was if you always do what you've always done, you'll always get what you've always got, which I think is quite good because it can be used in any situation, any relationship, any work problem. You know, if we keep trying and knocking our heads on the wall the same way, we're not going to get where we want to go. So I think just keep trying something different, I suppose.
Yeah.
And a more lighter saying, maybe not advice, but saying is maybe just don't let the bastards get you down.
Yes. Yes,
that's always a good one that was told to me.
My granddad says that.
Yeah, that was from
don't
my
let
dad.
the bastards get you down.
Yes. So,
I love that. Thank you so much, Catherine. Really appreciate you giving us your time and your insight today. It's been really helpful.
Oh, thank you very much for having me.
Thank you, Catherine. Thanks for coming in. Appreciate it.
Thank you.